I'd like to take a second here and talk about copays on the ACA Marketplace health plans and how those copays work. So when you are on like myself, very popular plan in this area is an expanded bronze plan. These are plans that were introduced in the last few years that are designed for individuals to have a lower deductible. Current state, there are $0 deductible expanded bronze plans available in 2024. And given that there's no deductible, there is no out-of-pocket costs to the member in order for the insurance company to start helping out with bills. What that means is we don't have to meet a deductible before the insurance company starts covering some of our services. So what happens with that plan is with a $0 deductible, there is a set copay for every service that our family could have performed. One of those copays, in a situation that came up a few times, I have kids, young kids that get banged up, and it doesn't really matter what time of day. They find a way to do it. So at times, the only place that we can go to is, urgent care or sometimes emergency room, depending upon what's going on. But recently, a family member of mine had to go to the emergency room. Everything's fine. Wasn't that big of a deal, but at the time, just needed someone to get a look at my family member. So one of my family members goes into the emergency room, and on this plan, on this specific expanded bronze plan that we have a set copay for walking in the emergency room. It's a facility fee, essentially. So that copay, believe it or not, is at $1,800. Okay, so when my family member went to the emergency room, the healthcare provider that we go to in network, that's the most they can charge for that facility fee. The emergency room fee is $1,800. So when my family member arrived at the emergency room, they asked for that $1,800 copay. They can see that on the insurance plan that we have, that is the designated copay. However, in our house, I know that we should send those to insurance before any copays are paid, especially when we're talking about dollars like $1,800, right? So when we're talking about dollar amounts that much, we're going to send that to the insurance company first. Let the healthcare provider bill what they're going to bill to the insurance company. Given that it's an in-network provider, there's probably going to be an adjustment on what is allowed as an in-network provider. At the end of the day, that service was very simple. It was an emergency room visit. Everything was fine. Released within an hour or so. So we waited for that bill to come in the mail. And now this is not a guarantee for every situation, but in our situation, that bill, I could see that the healthcare provider billed our insurance company just under $600 for that visit. So that $1,800 copay, which was asked by the healthcare provider at the time of service, we decided to forego that route, bill it to the insurance company first. So the healthcare provider billed under $600 for that visit. Our health insurance company adjusted those amounts, and the final bill, currently what we have to pay off of that, comes in at $107. So the importance of knowing when to send a bill to insurance first is really important. I mean, I'm not saying that we couldn't have gone back and probably filed an appeal or asked for a reimbursement after paying that $1,800, but save yourself the headache of trying to go back and get funds that you paid at the time of visit because it didn't cost that much in the end. Save your headache, send it to the insurance company first, pay your bills on the back end.